A very good morning once again, and I'm glad that you've kept it here on MorningAtNTV. For those that are joining us from wherever you're watching, a very warm welcome. You join us at the Tech Note segment, where we shall be talking social protection and Uganda's budget priorities. Of course, we all know that the anticipation is high to the reading of the budget that will be coming through in June. But what are the priorities when it comes to allocation of monies to critical aspects of the economy and society in general? Social protection is pretty much very important, and Uganda's budget priorities reflect a significant emphasis on social care, aiming to address healthcare, education, social welfare needs, and a range of other aspects. With a focus on improving access to essential services, the country is allocating substantial resources to bolstering its social care infrastructure. I'm joined by two guests who will be helping us understand where we stand, what ought to be done, and what kind of direction social protection should take. Patrick Chichonjo Katawazi is the coordinator of the Parliamentary Forum on Social Protection. Many thanks for joining us.
Yes, good morning, and the pleasure is mine.
And many thanks for joining us too, Teopista Kiza, Programs Manager at Africa Youth Development Link.
Yes, good morning, and I'm happy to be here.
It's a pleasure to have you both on the show. Let me begin with the chairperson of the Parliamentary Forum on social protection. The budget reading is one of the most anticipated events of the year, and the allocation of monies to various aspects of the economy is one that many lobbyists and people who are intervening in various aspects of the average Ugandan's life look out for. As a campaigner and an advocate of social protection, are you happy with the noise that is coming out of the corridors in Parliament with regard to what is contained in the budget for the next financial year?
Yeah, to answer your question directly, I think not very, very happy. And I want to give it context. About 20.3% of Ugandans live below the poverty line, and about 45% of Ugandans, although not very poor, at any slightest shock, they can easily fall into poverty. That could mean loss of employment, that could mean drought, that could be a bad season. And that tells you how delicate the subject of social protection is. Very, very important subject, and I wish NTV could make it a daily topic so that we can exhaust it. The reason is that in social protection we are talking about private and public interventions that are aimed at cushioning people against risks and shocks that come through the life cycle. We are talking about children, we are talking about youth, we are talking about women and men, we are talking about older persons, persons with disabilities, and the aged. So that's really a very, very complex scenario. And when you look at our spending generally and compared to the rest of the world, including our neighbors, we spend about 0.7% of our GDP to social protection, far, 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 far below countries, smaller countries such as Rwanda, and of course that speaks so much about our priorities. I'm going to speak particularly about my area of focus, largely SAGE, which we have been talking about over and over. And I think in the budget, National Budget Framework paper, which is a foundational budget document, there was an indication of 121 billion against the target of 142 billion to cover older persons who are 8 years and above. And for me, that shortfall is still persistent. It needs to be closed. We've been also talking about the issue of the disability grant, the special funds for persons with disabilities, whose budget is about 16 billion, and in the current budget we are looking at about 13.2 billion. You're also looking at the other special grants for older persons as well, whose budget has been 10 billion, and the allocation is about, I think, also 5 billion. And many other supporting social protection interventions whose budgets are falling way below the expectations. And I think as a country we need to understand that social protection is a very critical intervention that, in my view, is the only surest way of dealing with poverty directly. I want to highlight one of the dangers of not focusing so much on social protection. We have very many social protection vehicles, of course, the ones that I have talked about. But then we also have NSSF, Social Security Arrangement under NSSF. The report that was released recently does indicate that over 60% of the contributors at NSSF, at the end of the day, get out their benefits about 10 million or less. 10 million. You've worked for your entire working life and you can only get 10 million. But then also 45% in that report, again, of those people find a need to work in order to survive. Remember, you're supposed to be retiring.
You're supposed to
and then 45% still see a reason to go and work. And that tells you so much. When you go to the side of health insurance, only less than 4% of Ugandans are covered under any form of health insurance. And for me, one of the key things that actually take money out of people's pockets is basically costs of healthcare, costs of education, costs of housing. And those could ordinarily, if we invested wisely, those could be accommodated in our wider social protection strategy, and that would be able to save people from sliding into poverty, but also building their resilience to overcome the shocks that normally come through the life cycle.
Okay, I'm glad you speak about the fact that investing wisely could be able to help settle some of these long-standing challenges when it comes to social security. Later, I'll be returning to you so you can share exactly what are those aspects of investment and how can a government like ours do this particular role or task. But let me come to Teopista Kiza. I'm sure you do agree entirely with Patrick Katawa's submission, but what is the picture like from the Africa Youth Development Link?
Thank you so very much. So to add on to what Patrick talks about is that looking at our demographics, you'll see that you have like 78% of your population below the age of 30 years. So that means you have a lot of children within your population, and then you have slightly like 23% who are youth between the ages of 18 to 30 years. So looking at the national budget vis-a-vis how it tries to impact on that bigger demographic of a country is that it is neglected. If we are to talk about social protection and looking at how our budget is focusing on its younger population, that means that government has to invest a lot in education that skills, but also ensuring that there is investment in healthcare so that our young people are able to access healthcare and be healthy and be productive at the end of the day. But then the budget in there hasn't been that much. And then also looking at the fact that a lot of financing of our current budget is dealing with the rising public debt that we do have. So most of the affected programs are those programs that are aimed at social protection. Like for example, if I talk about the Youth Livelihood Fund, it's one of the programs that suffered some bit of the cut, quite some big cut. If you look at the women entrepreneurship kind of like fund, that was also affected. So you see that when it comes to government prioritizing, they will look into those sectors that help young people and cut off some of the funding to be able to finance other areas, which is dangerous for our country and our economy. Then the other thing is that we have a lot of people who live with disabilities. I think around 11% of our population live with some form of disabilities. And looking at our infrastructure and how it supports and helps these people to access services, including healthcare, is that our infrastructure is still not providing that, and government is not doing enough to ensure that there are certain kind of like services that are put specifically to support these categories of people to be able to access the services that are available. Because in this coming budget, I think the health budget is going to lose some bit of money. It's one of the areas that is going to lose some bits of money. So we feel that if government wants to ensure that you know, we have a healthy and productive population, then there should be investment to those people that really need the money, so that they are able to contribute effectively to the development of the country. Looking at, I see, okay, there is some little focus now more on still investing in HIV and AIDS. If you look at the report that came out, is that there has been a surge in the cases of HIV and AIDS, and for most of those that are really affected are adolescents and young women, and that is really, really dangerous for our country. We know that during the COVID-19 pandemic and post bit of it is that there were surges of teenage pregnancies, so we have a lot of young people who suffered from that. But where is government investment in terms of ensuring that we are able to ensure that those girls that were affected by that are still able to come through the education system, or they are skilled so that they are productive? But if you go up country, the situation is really worrying. We work with young women living with HIV in the East, and the situation is really dire. You see a lot of them very young, still teenagers, but living with HIV, having children. And to make it worse is that government is launching programs like the parish development model, and one of the things for one to benefit from such programs is that you should have a national ID. But here you have this adolescent who already has a baby, they are out of school, they are in the community, they are not 18 years, they don't have a national ID. So they still even cannot benefit from the government programs that are available. Okay. So I think government really needs to look into that and ensure that there is investment in that demographic, and ensure that they are able to live healthy lives and be able to contribute to the country's development.
All right, that effectively leads us into the question that I spoke about earlier, investment in social protection interventions. Ideally, I not even suspect, but I know that all kinds of investment any government undertakes is for the social protection of the nation, and whether there are specific or indirect investments, it all leads to the fact that the population must be good enough to be able to be, you know, to grow older, reach years. For example, we should be able to be 75 and still be of good use to the country. Unlike where after 55, then challenges begin to come in, diabetes, a lot of diseases here and there, that affects productivity. When it comes to benchmarking on what kind of interventions are being done by any other country that is effectively or doing this better than Uganda, what are these benchmarks, and what are the direct investments that can be undertaken?
Kenya, for example, is doing very well. It learned from Uganda, so to say, including Ghana. Yes.
Kenya took a blueprint?
Yes.
It made it better?
Even Ghana, on the social assistance grants. The experts in Uganda who started social assistance grants for empowerment are the ones who advised and who set the ball rolling in Ghana. And those two countries are doing very well on the social assistance grants. On health insurance, Zambia is providing a very good example on how a small country can run a comprehensive health insurance scheme. And of course, Tanzania has also done a good job in reforming the equivalent of the NSSF. And we have also been saying this. I know it's not a very popular view, but I still hold the same belief that our NSSF, as long as it remains more or less like a provident fund, our people shall continue to be vulnerable after accessing their benefits, because studies have demonstrated that within 6 months, after getting 10 million, 20 million, or even 100 million, it's blown up and you're back to square one. And yet, ordinarily, to live through life after retirement. You need something that is consistent.
Yeah.
It might be very small, but it needs to be very consistent, very regular, and very predictable. That's how you can be able to beat fangs of poverty at a very old age. So I think our neighbors still can provide good examples. If you want advanced examples, then you go to countries like Mauritius and Seychelles, which have very comprehensive, for example, antenatal care system that is very efficient and have maintained for the last 7 years 0 maternal death. That's a very good social protection measure, because here you are trying to address social protection of the life cycle. That a woman gets pregnant, a child is born, a child is looked after very well, then transitions to the youth stage and then the adult stage. And I think for us, we're still missing the point. 30% of our children are still stunted. That speaks a lot about the kind of future generations that are going to come after that. So there are many countries around us, not even the advanced European countries that people normally think about, even African countries that provide very, very good case studies that we could learn.
Let me stay with you shortly. You spoke about the fact that the NSSF is not fit for purpose, being a provident fund. Are you talking about liberalization of the pension sector?
Those are two different things. Okay. Liberalization is, yes, it could also be part of the equation, but ideally, if I have made contributions to NSSF, at the time of accessing the benefit, part of it could be spread. Part of it, a small part of it would be given to me as a lump sum, and another portion, a bigger portion, could be spread over 15 years, for example, so that I can be able to draw a monthly pension. And
more like pensioners from public service.
Yes, exactly. And also, still, on the same point, our public service pension also must be reformed. For how long shall we keep financing civil servants to earn their pension, yet us in the private sector, we are paying 100% for our pension? They also need to make it contributory so that they can also from their own salaries make a contribution for their own social security, just like we do in the private sector. So that at the end of the day, if the government is saved the burden of paying 100% the entire bill of their pension, and for me that would be the correct way to cushion people who have worked so hard against old age poverty, getting something sustainable, something that is regular.
All right. Equitable distribution of resources for social care across different regions in Uganda. During your work as the Africa Youth Development Link, I'm sure you've come to understand the challenges that many of our fellow Ugandans go through, and there are pilot projects that have been undertaken across some regions. I don't know whether you have knowledge of the fact that either this has been spread out or we continue to still work within a silo system where one region gets a different threshold than another, which of course could lead to disparities in how people, become resilient when it comes to social protection.
Yeah, so I think when it comes to social protection, first of all, I think there hasn't been so much of an effort to have a coordinated kind of like approach in terms of government interventions. If you look at our country and how it is that different regions, I think, have different needs. So I feel that the way government works in terms of having this program and thinking that the entire program will work the same way across is a wrong approach. It is a wrong approach, and that is where I think now National Planning Authority comes in handy, because its role is to try and do research and ensure that government plans inform government priorities when it comes to budgeting. But usually, or most times, government will come up with a program and they dump it within the public and assume that each and every region, has a similar kind of like context, and yet that is different. One of the things that we've struggled with for young people is that, youth are kind of cross-cutting. So their programs, interventions are in different sectors, ministries, and government agencies. But now we don't have a kind of like where we are coordinated to ensure that there is harmonization of these programs. You'll find that there is something in agriculture, there is something at Prime Minister's office, there is something in the Ministry of Gender, and that in a way makes it hard for government to even monitor and see whether it's creating impact on the people or not. Are
you calling for a separate ministry, an entire ministry dedicated entirely to this aspect and not falling under any one department of government that is already existing?
Not as such, because for one of the things that we are still fighting is the creation of more units that will put pressure on government. But we already have some, like for example, if you look at the office of the Prime Minister, they can, you know, try to coordinate interventions that target young people to ensure that we are not scattered. Small funding is scattered across these other ministries. So can we have one place where young people know if we go here, then we will be able to ensure that we are helped, or we are able to secure some funds that we can use for investment.
Patrick, I'm sorry to cut you short on that, but I'm running out of time, and I would love you to have the last word, given the fact that you are overseeing matters within the Parliamentary Forum on social protection. When it comes to legislation, what are the hurdles right now? What are you pushing that seems not to go through the corridors of power?
Yes, we have the National Social Protection Policy 2015. I think it should be under review right now. We recently got the National Social Protection Strategy. What we are missing right now is a law that strengthens the social protection agenda for this country. And there are quite a number of laws that we are looking at. The reform of the public service pension scheme. I'm still enthusiastic about the reform of NSSF one more time. We had an entry point for the informal sector, but we think it should provide a product for people who might prefer. If it cannot be mandatory, let them give me a choice. I could prefer getting my money 100%, another person could prefer spreading it for a very long period of time. But we also need a social assistance act or a social protection act to be able to guide implementation of all these programs. Like she has said, most of the social protection programs are scattered all over the place, and without harmony, implementation, monitoring and oversight will keep a challenge.
All right, ladies and gentlemen, I'm out of time, but I'm going to have to create some for a notice of special meeting for the National Union of Women with Disabilities, that is NAWODU. The purpose of the notice is to invite paid-up members for a special assembly meeting that is due to take place on the 18th of April at Sportsview Hotel in Chireka. Arrival is expected on the 17th of April. The agenda will include Treasurer's report and reactions, Chairperson's report and reactions, legal interpretations of the Special Assembly elections, resolutions, and the way forward. I thought this is important because it falls well within aspects that should be able to strengthen the spectre that we are grappling with other country right now. Many thanks, Delpista Kiza, Programs Manager, Africa Youth Development Link, and many thanks to you too, Patrick Chichoncho Katabazi, Coordinator, I must emphasize, of the Parliamentary Forum on Social Protection. That will do it for Take Note, but do stay with us. The Kickstarter discussion will be beginning in earnest after the break.